Alport syndrome and neuronal linkage. Alport syndrome is not only a kidney disease, it's a collagen related disorder that can also affect hearing and vision. In this condition, mutation in type 4 collagen gene damage the basement membrane of the kidney glomerulus, leading to blood in urine, kidney protein loss, and progressive kidney failure. It also affects the ear and eye, and also affects the sound signals and pull it transmitted to the brain, causing sensorineural hearing loss. Eye changes may also disturb visual input. So these are the involvement of Alport syndrome with neuronal linkage. Hi, my name is Dr. Ras, and today we're going to discuss Alport syndrome and neuronal linkage. The core triad uh, of the organ involved in this disease are the kidney, inner ear cochlea, and eye lens retina. Neuronal linkage is mainly indirect through auditory nerve signaling. Optic pathway input and advanced kidney disease affects the nervous system. Disease description: main three genes are involved: COL4A3, COL4A4, and COL4A5, which results due to mutation uh, in hematuria, proteinuria, progressive kidney disease, sensing neuronal hearing loss, and ocular abnormality. Inheritance pattern: X-linked Alport syndrome leads to autosomal recessive Alport syndrome, autosomal dominant Alport syndrome. Family history, persistent hematuria, and genetic testing should be there in these kind of patients. Organ pathology: kidney, glomerular basement membrane. Kidney disease may progress to chronic kidney disease or kidney failure. Ear cochlear basement membrane, when affected by the gene mutation, causing auditory nerve to receive reduced or distorted sound input. In the eye findings support clinical diagnosis like pigmentation, retinal flecks, or retinal uh, disturbances in the eye. Molecular mechanism: the mutation in COL4A3, COL4A4, and COL4A5 leads to uh, defective type 4 collagen and abnormal collagen network assembly, basement membrane weakness, organ specific injury, and clinical triad, as we know that kidney, ear, and eye get affected. Mechanism: type 4 collagen mutation leads to cochlear basement membrane defects, which leads to reduced hair cell uh, mechanotransduction, weak auditory nerve signal, auditory cortex under stimulants, and hearing loss impacts communication. Advanced kidney disease may cause hypertension, uremia, anemia, electrolyte imbalance, which can affect concentration, fatigue, peripheral nerves, and severe encephalopathy. Cochlear basement membrane hair cell spore disturb, which leads to reduced auditory nerve firing, brainstem auditory nuclei, and auditory cortex signals deficit. Reduced sound input can affect speech development in children, learning, and social communication. Neuronal consequences include hearing loss or cochlear implant may uh, cause better uh, betterment of the patient which have auditory failure or auditory loss. Patient may have difficulty understanding speech, especially in noisy environment. Visual neural linkage leads to lens capsule retina defect, anterior lenticonus, distorted retinal image quality, optic nerve and LGN input, and visual cortex processing stress. Visual acuity may remain good in patients, but lens involvement can impair image clarity. Eye examination helps can detect the Alport associated signs and guide visual support. Kidney brain linkage GBM damage leads to hematuria and proteinuria, hypertension and CKD progression, uremia, anemia, electrolyte imbalance, especially with sodium and potassium, fatigue, poor concentration, and severe cases neuropathy and encephalopathy. Diagnosis: kidney, blood pressure monitoring, GFR, proteinuria checking, hematuria should be analyzed for kidney assessment. Hearing loss should be monitored. Uh, Ophthalmology examination for anterior lenticonus and retinal flecks. Genetic diagnosis: whole 4A3, 4A4, and 4A5 is central to diagnosis. Guides counseling, monitoring, and transplant donor decision should be given. Treatment for kidney: uh, ACE inhibitors, ARBs should be started in these kind of patients uh, to save the kidney from CKD and kidney failure. Uh, Neuronal sensory support, it depends educational and speech language support when hearing and vision affects the development. Advanced disease, which includes the anemia, electrolyte imbalance, and CKD complication, uh, should be monitored and treatment should be started when these diagnoses uh, clear the path for the treatment. Prognosis: family history can provide clues, but the severity varies depending upon the patient to patient and family to family. Kidney transplant generally offers good renal replacement outcome, uh, and treatment with ACE inhibitors, ARB should be there uh, before the kidney disease or get uh, chronic or CKD may affect the patient health and if not treated properly may lead to kidney failure. That is summary. Primary organ triad: kidney, sensorineural hearing loss, and ocular abnormalities. Uh, CKD should be treated, and the patient with this kind of disease uh, should be started with the ACE inhibitors, ARBs, plus audiology, ophthalmology, CKD, and genetic counseling, and kidney transplant when needed. Thanks and regards. Please like and subscribe this channel for further discussion on different rare diseases.